Morpheus for face is a piece of equipment from InMode Aesthetics. It is a radio frequency with microneedling. It is what we say would be like a minimally invasive procedure. This is not a non-invasive procedure. There are some clinics that may market this as non-invasive, but I would say this is much more minimally invasive, and this could potentially even be considered more like a surgical procedure. This is a very intense procedure. So with the Morpheus8, we have 24 pins. They are stainless steel and then gold coated, and they pierce the skin. The reason the machine is called the Morpheus8 is we can potentially go down as deep as 8 millimeters. In the face, we don't go down that deep. The deepest we go is 4 millimeters with the pins, but the amount of radio frequency travels around the pins and can go as deep as 5 millimeters. One of the reasons the Morpheus8 is the #1 piece of microneedling with radio frequency is that it's the most effective. We're able to go down to deeper depths. We're also able to go up to a much higher radio frequency. There's several other devices out there that are not nearly as effective, and Morpheus8 from InMode, they have the patent on this technology. We do provide several items for analgesia. So when a patient comes in, first of all, we need to determine that they're an appropriate candidate. But second of all, we do have to determine their pain tolerance. If we have a patient that doesn't think that they're going to be able to get through the procedure, maybe we would suggest something that's a little more non-invasive that hopefully they would get a similar result from. But with the Morpheus, it is somewhat uncomfortable. I've done 5 of these treatments myself, and I would say I got through them fairly easily, but we did use Prox. So let me talk kind of about the different types of analgesia. We start with a topical numbing cream. We use a plasticized ointment or gel, which is much more effective than like a lidocaine cream or even a compounded benzocaine lidocaine tetracaine cream. And the plasticized gel is able to numb the skin a lot more effectively and is kind of the gold standard for external numbing for the Morpheus. We also utilize a system called Prox. Prox is 1 part nitrous, 1 part oxygen. So the gas is running through the piece of equipment. There's a long tube that the patient is able to control the amount of nitrous and oxygen that they're inhaling. So again, the nitrous is split with oxygen. This is very different than when you go to the dentist and you have like a nitrous mask. This is not a mask. This is all patient controlled. So we don't want the gas escaping through the patient's nose. So we plug the nose and then we have them take slow inhalations and exhalations. With nitrous, you can fight through the pain, but if the patient really focuses on their breathing and getting through the procedure, it's a wonderful form of analgesia for the procedure.